Hi, this is Rob Packard from Medical Device Academy. This is a quick video explaining how to execute a document change notification, or DCN. This is the core process behind our document control procedure. I'm also going to review the document control procedure and the additional forms and logs that you get when you purchase that procedure. So on our website, medicaldeviceacademy.com, we have an SOPs page. So you click on that link and it takes you to this page. And these are all our standard operating procedures, or SOPs. And at the bottom of the page is a link. And here's all the links for all the procedures. But if you click on this one for document control, it takes you to the page where you can purchase the procedure. And I'm going to be updating this page to put this video in here, right where this image is right now. So this page will be updated very shortly. But if you go ahead and purchase this now, what you will receive is our document control procedure, our document change notice, which is a form you fill out when you approve a document or a form or a log. And here are two different logs that we provide. One is a master document list, and the other one is our document change notification list. So I'm going to walk you through each of those forms and show you how to fill them out, because this is the first step you should be implementing when you purchase our procedure and you're approving documents. And this is the first video really that all of our clients should be reviewing when they purchase our turnkey quality management system. So I'll take you to that page. So here's the procedure. It's at draft number 14. The first thing you're going to do when you purchase these procedures is you're going to review the procedures and you're going to eliminate this draft. And you can put your own name in here instead of mine if you wish. And you can also put in the effective date. You have a couple of choices with date. It can be the date that you approve it, or it could be a date in the future. A lot of companies will have, sorry about all our notifications popping up here. The effective date could be a date that's in the future to allow time for training. So sometimes you don't want people to train on a procedure that hasn't been approved, but you don't want it to be effective until the training is completed. So you might choose 30 days in advance. And that could be a default plan for all procedures. You give people 30 days to train on it. And then you could accelerate that by picking a different effective date if it's part of a corrective action plan for the FDA due to an inspection finding or something. So we have a purpose of the procedure, we have a scope, and one of the things that Matthew Walker, one of our employees, has added to the procedures recently, and we're adding this as we go, but he's already done it for this procedure, he's added in a cross-reference to the ISO 1345-2016 standard. And the reason why he did this is because even though we have all the requirements for ISO 1345-2016 in all our procedures, it wasn't obvious to the auditor. And some auditors will take the time to look for it, and they're looking for conformity, which is what they're supposed to do. But some auditors were not trained as well, and they look for nonconformity. They're looking for something to write you up for. And that's not how they're supposed to do their job, but that is what some auditors do. And in that case, it's really up to the person that's the quality manager that's facilitating the audit to be really familiar with the procedures and know where the requirements are. And so if you're brand new to quality systems and you don't know all the regulations and requirements by heart, it becomes a little bit more challenging. So this was put in there for our really new clients that are new to quality systems, and we've given them a new quality system and they have to sit through their ISO certification audit for the first time, and they may be a little bit nervous and not remember where some of the requirements are. So this is to help the auditor find things and help our clients show the auditor where they can be. So like, well, the requirements should be in blue and a cross-reference, and oh, here it is right here. And that's explained down here. It's not a requirement of the standard that you do that, but we did that as a corrective action to help some of our clients. And we haven't put it in all our procedures, but we're going to do that every time we make an update to a procedure. Here's a general flow chart explaining one of the inputs is the change control procedure. So every time you need to change something. If it's a document, this is where you would change it. So any associated procedures, work instructions, they would be changed for this procedure, but this would be an input. And the forms that would be an output would be, as I said, Your document change notice is one of the forms. The master document list would get updated indicating what the revision is and what DCN was involved, and the actual DCN log. And then you should also update your training procedure to indicate if any training was required. We have who's responsible for this process. This is something you might change. So the titles might be different in your company, but you decide who has to review and approve procedures. You can make it a whole army of people, but I don't recommend it. As a minimum, I like to see at least 2 people approving procedures so you have somebody reviewing and editing your work. So the author and usually the quality manager. But if the quality manager wrote the procedure, then maybe somebody else should be reviewing it, such as the quality manager's boss. So at least 2 people is a good idea, just so you're not editing your own work when you review and edit and approve procedures. The next thing you'll do is you put in the date that you're approving your DCN, the DCN number beginning with a year, so 2019 would be 19 dash, and then a sequential number, starting with 001 and 002. If you don't like this numbering system, you can change the procedure so it doesn't have this numbering system. But that was what we created, is a very simple system to indicate what year it was done and what sequential number it was. And then you would fill that in the log. And if you make a revision to a procedure, you would create another row like we have down here. So I would just click on this row here, press tab, and now I've created a new row, and I would say B, and I'd say 19 dash, let's say it's the second one. Oh, that's supposed to be the date, sorry. So 11/14/2019 and 19-002, and it could be corrected a typo and missed typo during initial review and approval, and put my name. And that's how you edit your revision history. And these are the roles and responsibilities associated with this procedure. In your company, some of these roles might be combined into one role, or you might have additional roles that aren't here. So that's something you have to decide when you review this procedure, is how does that fit with your organizational structure and your org chart. But I don't, in general, recommend putting names here. I recommend putting titles, positions. Then we have the procedure, so it has several different sections, and these follow 4.2 A, B, C. So Matthew's made it very nice for us to walk right through what's required. And then the document preparation approval, he explains how to fill out the DCN, and then how to train on it and release the procedure, and then how to obsolete procedures. And there's a requirement in the ISO 1345 standard for controlling documents of external origin, and every certification auditor will be looking for that. Specifically, how are you controlling standards? How do you make sure they're up to date? How are you controlling, if you're doing an MD-SAP certification, how do you control the Canadian medical device regulation in your quality system? How do you control any standards? How do you control FDA guidance documents? How do you keep track of that? Because you didn't create it, you don't review and approve it, but you want to make sure it's up to date and people only use the up-to-date version. So that's how we propose to do it in here, is written in this paragraph, but you can pick a different method, but you have to have some method for controlling external documents. Another thing that we've added to all our procedures is monitoring, measuring. This is how we meet the quality objectives requirement. It's also how we make sure that we're continuously improving and monitoring the procedures and improving the procedures. So it meets several requirements, but you can decide how you want to monitor and measure this process. I said here, procedures were to be reviewed at least every 2 years, and on the master document list, you would enter the date 2 years from the date of release. So if it's been reviewed recently, when you sort the list, it'll tell you what is the oldest one, and you would update and review those. But as long as that list makes sure that everything's been updated at least in the last 2 years, then your quality system procedures are up to date. You may choose something more frequent. You might choose a year. There's not a requirement to do this. There's a requirement to maintain the effectiveness of your procedures. How you do that is up to you, but this is one very common way. We also have a training section where we talk about who should be trained on this procedure, as well as who should be trained on any revisions to the procedure. So if you make a revision, who needs retraining, who doesn't need retraining. If it's just a minor typo change, you're not going to have any retraining required. So you would say no retraining required for revisions from Rev A to Rev B. But since this is Rev A, we're only going to have training requirements. And then we have a risk management section. You're supposed to apply risk management to all your processes. It's supposed to be a risk-based quality system. And so we identify the possible, we call them hazards, but they're not technically hazards according to the 14971 definition, because 14971 requires harm, and you make a mistake in your document control system, it doesn't cause harm to somebody, but it is a hazard as defined or a risk associated with ISO 9001. So it's an inconsistency or uncertainty in your quality system. So using the broader definition of risk from ISO 9001 instead of 1345, this is how we apply risk to procedures. And we have our risk controls over here on the right-hand side here. And then we have the records that you'll maintain here. So that's everything that's contained in the procedure. Now I'm going to show you how to fill out the form. And this is fairly simple. This is just the reversion of the form itself. So when you're first approving this, you'd eliminate that draft part. And then you'd say whatever the next DCN number is in the sequence. So we said 002. Was the one we were using for this example. And we would say today's date. And we'd say 2019. And put my name here as the person initiating this DCN. And the document that we're going to update is SYS-001. And it's the document control procedure. And we're changing it from Rev A to Rev B. And the summary of changes should be an exact copy from your revision history on the document. So what we had here was correcting a typo. And we have this is the reason. So those should match up. Now, if you're revising a form like this one, you're not going to have a revision history on the form itself, but you can put it here anyway in the DCN. And if you have one of our other documents, I'll show you how to update it there. And then you would indicate the roles for review and approval. So it would be probably the author, me. So let's say I'm the quality manager, and I'll put my name, and I'll put my signature after I PDF the document, and I'll put today's date. And then whoever else is going to review and approve this, it would be the other person I put there. So that's how you fill out that form. And you would save it as a PDF, or you would print it out and save it as a paper file. Either method would be acceptable. If you have an electronic system, then you're going to have electronic signatures. But if you don't, then you're either saving it as a PDF with an electronic signature created by PDF. So basically doing a screen capture of it, or you're printing it out and doing a wet signature. Either one would be acceptable. And then we have a third and a fourth procedure here. So one is our document change notification list. So every time we create a DCN, we're going to add it to the list. So this form was created back in 2015. That's why they all begin with 15. So when you start this out, you would just start with whatever your year is and then a sequential number. And we would say we're just updating SYS-001. And we're saying routing for approval. And it was dated today. And I was the initiator. And once we have the second signature on it, then we add the release date here. And we change this to approved. And this is where we actually have a little bit of a problem. This can't be a record if it's in Excel, and you can change it without being able to see who changed what when. So that's one of the ways Microsoft Excel is not compliant with the Part 11 compliance requirements. So one of the ways to do this would be to fill this in, or sorry, not fill this in, but print it out and fill it in by hand, so you have a paper record. Another way would be to convert this form over to an electronic record system. A third way that I've seen a lot of companies do is periodically, once a month, they will print out the page and they'll start a new one. So that way it's possible somebody could make a change to the record during that month, but at least everything that is last month's work would be frozen and maintained. It's not technically compliant, but sometimes you as a company are trying to come up with ways that are practical for keeping track of records. And I haven't seen any auditors critique this particular method of keeping track of your DCNs, but technically it's not compliance with 21 CFR 8, Part 11. There's also another piece to this form. There are two tabs at the bottom. One is the revision history. So this is the revision history of this particular form. So it's Rev A. This is the DCN that it was approved on, and let's say it was approved on that date. And so that was when this form was approved. But if we make revisions to the form, then we're going to change this down here. So that's how you fill out that Excel spreadsheet. And then we have a second one that's the master document list. And once again, if we're approving our master document list, every time we update the template, we would put in a new date here. And so this is just the revision history of the master document list template. And then the actual contents in it, this is just green as an example. But if we change this to Rev B, and I had it green as an example, it should be black if it's no longer an example. So we change it to B, and we change the DCN to, or actually that should be DCN, not ECN. So we have the DCN that Rev B was approved on, which is DCN 2, and the parent document to the document control procedure is the quality manual, and the date it was reviewed was this date, and we're supposed to review it. This is automatically set in there to automatically tell you this is the date you need to review it by 2 years from now. So you can quickly sort the procedures by the date that it's supposed to be reviewed or the date it was last reviewed. So that makes it useful from a monitoring and measuring standpoint, but it doesn't technically make it compliant with the Part 11 requirements. So that's one little problem with using the Excel spreadsheets, but it's certainly more convenient than other solutions. But the most important piece is to make sure that this becomes printed out or PDF'd, so it is maintained as a record, and same thing with your actual procedure. Because those you're not going to get away with just having an unprotected Word document. So that covers all the content of our document control procedure and the associated forms. When you purchase this procedure, you will receive a confirmation email first. And then when you click on that confirmation email that, yes, I agree to subscribe to this updates about the document control procedure, then you'll get this second email that'll give you this content, and it lists all the things that are attached. So we have the procedure, the form, the 2 Excel spreadsheets, but then it also has a link for this, which is a template for blank procedures. So a lot of people ask me for that. So you click on this, and it allows you to pull that up. Okay, so that's the blank one if you want to create any work instructions or procedures of your own. And then this down here is a link to other quality system procedures as well. And that's where I started you at the beginning. so you can purchase any other procedures that you're interested in. And then we have a little bonus at the end here. We have a slide deck on GDP 101. So this explains basic good documentation practices and walks you through examples. Talks about red pen and markers and whiteout and things like that. Gives you examples of horrible document control practices from ages gone by and use of whiteout that isn't allowed. And then we have an actual recording that you can download, or you can actually play it. If you just click on this, you can play it, and it walks you through the video, which is 25 minutes long. Let's see, is there anything else in there? And then it also gives you a link here if you're interested in purchasing the control of records procedure. So that's everything that you would get in that email, and explains the details of those procedures and how to execute the document control process to approve procedures. So that's the first thing you should be trained on, is step-by-step how to approve procedures and implement your quality system. So everybody should be watching this and the GDP 101 training if you're starting a brand new quality system that we provided to you. Thank you, and if you have any other questions, don't hesitate to contact me or set up a meeting with me through our Calendly app. Thank you and have a great day. Bye.